Good morning, everyone, and welcome to today's webinar, Getting Safely Back to Business with our friends over at Orlando Health. Today, we have three panelists that are joining us. We have Andy Gardiner, Senior Vice President of External Affairs and Community Relations, Kelly Edmondson, who is the Chief Nursing Officer at Dr. P. Phillips Hospital, and Dr. Antonio Crespo, who is the Medical Director with the Orlando Health Medical Group and Infectious Diseases. I'm going to go ahead and let them introduce themselves, and then we will start. If you have any questions throughout the presentation, please feel free to enter them in the chat feature, and we will go ahead and facilitate those at the end.
Good morning. As Amanda stated, I'm Kelly Edmondson. I am the nurse executive here at Dr. P. Phillips Hospital and St. Cloud Hospital in Osceola County. I have been partnering with Dr. Crespo, Dr. Plumley, who is a Chief Quality Officer, and Thibaut Van Mark, the President of our hospital here, on our Business Ready initiatives, partnering with local agencies, including the AAU, some partnership with MLS on really reopening safely, developing plans to ensure that local organizations are able to ensure that both their patrons and their team members are well informed and safe as we get back to business. So I'm excited for the opportunity to share some of those learnings with you.
Good morning, this is Andy Gardiner, Senior Vice President of External Affairs for Orlando Health. We have been a part of this journey a couple months now, soon after the first wave of COVID hit, putting together a committee with Thibaut and Dr. Plumley and others on how we could help businesses reopen. We've probably advised 75 different organizations and businesses on their reopening plans, giving suggestions and recommendations. So we're looking forward to the conversation this morning.
Good morning, and I'm Antonio Crespo. I'm one of the infectious diseases physicians in Orlando Health. I'm based in Dr. P. Phillips Hospital, but my team covers pretty much all the hospitals from Orlando Health. And we've been taking care of patients with COVID-19 since the beginning, initially planning to get ready, and then seeing and taking care of patients since mid-March. And I'm also be part of this team, helping businesses and a community in general to get back to work, offering advice, and in my case, from the medical standpoint, in how to safely reopen. So I'm glad to be here.
Great. Thank you, everyone. Let's start by giving an update on the hospital system and COVID-19.
Well, good morning. So as an organization, we have really been in the fight since mid-March, likely when the first patients were presenting. We have learned a lot over the last few months around care of the patients and how to ensure that we get people home safely, how we keep their families updated and allow them to return to work, to home, minimizing the impact to those around them. So we've had a lot of learnings and advancements in the way that we're treating the disease along the way. There's an obvious increase in the community, and so we've certainly seen those in our facilities, but we remain well equipped to handle visits to our emergency department, to be able to admit patients to the right level of care, including our intensive care units. We have a very skilled team of infectious disease physicians, infection prevention practitioners, respiratory therapists, and nurses who have received some advanced training in really caring for the specifics of this disease and teaching our patients how to be able to manage symptoms safely at home while keeping their loved ones and friends safe from transmission. So we've had quite a bit of success in managing the disease internally, and really have been able to minimize any impact or transmission inside of our walls, despite the number of patients we've seen in our communities.
Thank you. I understand you recently launched a task force devoted to supporting the business community. Why is that a priority for a hospital, and who is involved in this committee?
I'm happy to take the first shot of this. So soon after we had quite a bit of the shutdown and the stay-at-home orders, we continued to track the numbers, and we started to see the drop in the number of cases that we had coming in. And David Strong, our president and CEO, asked Thibaut Van Mark and Dr. Plumley to chair a committee to help businesses reopen. And the idea, which I think is proven to be very successful, is we as a healthcare organization, number one, we have an obligation to support and help our community. But the second piece of that is our success is based on the success of the businesses around us. So we put together an internal group with Dr. Crespo's help and others, what it would look like for a business to reopen. What we found at the time is businesses were asking questions about masking, cleaning, various different things that they should do. And so what we did is we put together a website and then started talking with businesses. The website is orlandohealth.com/business ready. And we would encourage everybody to go to that site. There's downloadable information as well as videos that you can use, and all of it's free and available to you to help you safely reopen.
If I'm a business owner or leader, how should I be using the resources that you just referenced on the Business Ready website?
Maybe I can take that one. So as Andy said, that we decided that we wanted to help the community to safely reopen and to get back to work, and that proved very important now that we're seeing an increase in the number of cases. So it's even more important that our community partners know how to prevent transmission of COVID-19. We believe that this is going to be a long run, more of a marathon rather than a sprint. We believe that we have to learn how to live with COVID. That's why it's on all of us to be prepared and to put whatever we can to prevent transmission of the disease. So with that in mind, Orlando Health put on the website that Andy referenced a lot of information and a series of videos in how to prevent transmission. For example, practicing social distancing, proper use of the mask, cleaning your hands, cleaning surfaces, how to identify symptoms of the disease, which is probably the most important aspect, is that when one of the employees or anybody that visits one of the locations has a concern that, or anybody has a concern that it could be infected, that person should not go, should stay home and avoid infect other people. So I think that in the website you will find very detailed information that you can use to share with your employees and to educate. We also provide one-on-one support. Several businesses have contacted us, and I have been going with Dr. Plumley. We take turns, and we have visited churches or local sports locations, and basically we go step by step in how they can safely do it, and they ask any questions they want, and we try really to using the experience that we have in the hospital to translate that into the community, and I think it's been very successful.
Thank you so much. I went ahead and I added the website to the chat feature if anyone needs to access that, if they weren't able to write it down, so you can access it there. What other services is Orlando Health considering offering to businesses?
You know, as the pandemic has changed shape and morphed, our services have aligned with that. And so initially, as businesses were really getting ready, we were helping people to develop screening protocols and helping their teams learn what symptoms look like to measure. We've developed plans. We've done walkthroughs at facilities to help them get open. We've also done some partnerships where we have become a preferred partner anytime an agency is concerned about a positive patient or guest. We've created some pathways to expedite care, either in our emergency departments or on our online platform, Virtual Visit, to expedite linking someone with a care provider and helping them prioritize whether or not testing is appropriate for them, helping our providers in a virtual space determine whether or not your team members can return back to work. And so we're really looking at providing an all-inclusive approach to helping our community partners, from preparing to visits to responding once there is a potential exposure, either to your guest or to your team members. And so those services, I think, will continue to transform and adapt as the needs of our community arise. I will say that if there are needs or desires from organizations, we're certainly willing to entertain and discuss whether or not we're able to meet those needs and adapt services accordingly.
And I would just add to Kelly's comments, if you go to the website, there is an email address. It's businessready@orlandohealth.com. I would encourage your members to send us questions that you may have that are very specific to your business needs. You know, each business is a little bit different, whether it's a restaurant or an office space. And what we found is that email address allows us to send it to leaders in the organization, Dr. Crespo and others, and we're able to respond relatively quickly to what your question is to help you prepare and to continue to provide service to the community.
Thank you, Andy. That was actually going to be one of my questions for you, so I'm glad that you were able to answer that ahead of time. What parts of your business just reopened, for example, elective surgeries? What are you doing to protect patients and visitors during those reopenings?
So I can comment on that. So I think that it is very important that the community knows that here in Orlando Health, we are able to take care of our patients with COVID-19, which, as we say, have been increasing the last few weeks, but also continue to take care of patients that do not have COVID-19. So life continues, people continue to get sick with other diseases, and it is important that people that come to the hospital feel safe, and they are safe. We have developed a system that we have designated units and designated staff to take care of the patient with COVID-19, and we continue to function in the rest of the hospital to take care of the patients that have other diseases. In terms of surgeries, we continue to perform surgeries, and all the patients that come to the hospital, and if either for elective or emerging surgeries or procedures, they get tested for COVID-19. If we can do it in advance as a part of the pre-operative process, pre-procedure process, we'll do it. But if it's an emergency situation, we have a capability to do a rapid test that we get a result in about an hour, and we can safely proceed. So that guarantees the safety of our staff as well as any other patient that could be present. So that I think that's important, that people feel safe when they come to an Orlando Health hospital.
Thank you so much. What are your final thoughts or recommendations to ensure the community is safe as we get back to business?
I think it's important.
Go, Kelly, go.
I think it's important to listen to what, the CDC says, what your public health department states. Hand washing and masking and social distancing are really the three easiest things that we can do to ensure our safety. And so we want to make sure that, especially as people are in indoor spaces, that we are attentive to the ability to be able to spread with droplets. And that means that maintaining a 6-foot distance, particularly for anyone that you don't share a household with, is incredibly important. Masking adds another layer of protection there. And then hand washing cannot be encouraged. This virus can live on surfaces for hours and potentially days. And so being aware of what it is that you're touching, particularly before you touch your face or put on a mask, is critical in being able to stay safe. And then lastly, I would say, is be aware of how you feel. If people feel ill, we need to encourage them to stay home, which may mean that as employers, we're more lenient on our attendance policies and an abundance of caution. You want to ensure that people who think they may have symptoms self-monitor and see a healthcare provider for testing when indicated, because it's one of the best ways to stop the spreads is to quarantine those who definitely are impacted by the disease. Dr. Crespo, do you have other thoughts?
No, I think that was excellent. I would just say that even though this is a new virus, it's a new infection, and we're still learning about it. There are some things that we know at this point, and that we should take advantage of that. And it's as Kelly said, it is transmitted by close contact. So basically, being in a close space, a lot of people together, that is a high risk situation. If you have to be in that situation for any reason, be sure that you wear a mask. But definitely avoiding those type of gathering, especially when there are people that you don't know well and you don't know where they have been. That is a high risk situation, and that's what we are seeing. Unfortunately, we're seeing a lot of young people getting infected, and then they come to the household and pass it on to the parents or the grandparents, who then have a worse course of the disease, and it can be more complicated. Also, people that go out and work, and depending on the type of work that you do, that could also be a potential high risk. So just keep the basics in mind. Again, this is a long run, and we have to be prepared, and it's on all of us to prevent how this virus is transmitted. So do not forget the basics. Social distancing, use the mask, hand hygiene, clean surfaces, don't touch your face, as Kelly said, and if you're sick, stay home. With those principles, we can get it done.
Thank you. Andy, did you have anything that you wanted to add?
The only thing I would maybe add, and Kelly alluded to this, is the importance of the self-assessment. We talk to businesses all the time that say, well, should we do temperature checks for our employees as they're coming in? And what we advise is, no, they should be doing that before they leave their house. It's important that if you feel bad at all, or any type of sickness or a temperature, don't even come in, because that's where the transmission happens, especially in the restaurant industry. That's one of the things that we've been advising, is do that self-screening at home before you even think about coming in.
Thank you.
Let me say something that it might be important for the owners and when taking care of sick employees. And one of the questions that commonly comes is, when can the employee that was sick come back to work, and when it is safe to come back to work. And maybe I can share what we've been doing, or we are doing now here at Orlando Health, and that has changed based on the CDC most recent recommendation, which is based on the duration of illness. So instead of requiring a negative test, which is something that a lot of places are asking for to get a negative test, the CDC now recommends that if you've been sick for more than 10 days, no fever for 3 days, and you show clinical improvement, that it is safe to return to work. And basically, it's because there is enough evidence that after day 10 of infection, you're no longer contagious, even though the test could still be positive, but you are no longer contagious. So that I think that's an important message that it would be help a lot of business owners to manage this situation.
Thank you so much. We did have a question come through on the chat, and it is, how do you see this working with schools reopening soon?
That's a big question. I know there's been a lot of discussion in the everywhere about how to safely reopen, and I believe a decision is going to be made soon in terms of our community. As in any of the situation that we're talking about, if it's done in a way that is well planned and with the precaution that we have talked about, I believe it can be done. Obviously, it's potential risk because kids may be asymptomatic or have mild symptoms, but they can pass the disease to the adults. But I think if we do it in using the principle that we have talked about of maintaining some distancing and using the mask and encouraging hand hygiene, and importantly, very importantly, identifying sick contacts and ask them to stay home. By practicing all of those, we might be able to do it safely.
Thank you. Another question is, people are concerned about dropping off their loved ones at the hospital and then not being able to see them. When do you see this changing?
You know, right now we are in the continual mode of how do we keep the community at large safe. And so as our numbers are rising locally, I think imminently, I'm not sure that there will be change. But what I will say is that there's a large team that meets at least twice a week to evaluate all of our practices around COVID-19. And so being connected to families we know is important both to healing and to service. And so it's something that we recognize as a key initiative and a high priority for all of us. But maintaining community safety right now has to be our utmost priority.
Thank you so much. I don't see any other questions coming across on the chat right now, but I do want to take a moment and thank all of you for participating today and giving us all of this information. Again, the website that they reference is www.orlandohealth.com/business ready, and the email address that you can use is businessready@orlandohealth.com. Pam Jones from Congressman Daniel Webster's office left a note in there that said thank you to Kelly, Dr. Crespo, and Andy for this update and important information. I'm not sure if you guys saw that, so she just wanted to share her thanks as well. This webinar will be available on the Chamber Facebook page, and it will be on our website under our South Lake Strong page for you to view later and to share. If any additional questions come in later, feel free to send those to me and I will distribute them as appropriate. So thank you again, Kelly and Dr. Crespo and Andy, for taking the time today to speak with everyone. We hope everyone has a great day and stay safe, everyone. Bye-bye.
Thank you. Bye-bye.
Thank you.